All right, so today's video is for people who have chronic knee pain, who previously have had a surgery and now have a scar or some damage around their tissue. So oftentimes people reach out to me and talk about, oh, I've got chronic knee pain. When you go into their history, they have already had a surgery. And when you have a surgery, you are obviously damaging the tissue and different receptors that live around that area. And oftentimes when people have pain, it's because there's a disconnect between the area where they've had surgery or where they're having pain and their nervous system and brain. So one pretty cool test and exercise that you could do on your own knee, if you've previously had a surgery or an accident, is just by improving the sensation around the scar or around the tissue of where you have your pain, where you had your accident. When you work on improving the sensation, your brain feels more connected to that area, and then it's able to feel less threatened to that particular place. And when your brain feels like there's less of a problem, less of a threat, it's also going to stop sending out pain signals, which is what you're after at the end of the day. So as you can see with Maria, she's got this really nice scar that goes all the way down like this. Starts at the top of her thigh, goes down on the inside of her knee and then wraps around. Okay, so just so you get a little bit of a better view of this scar here, right? So this is an area where Maria has had an operation, dealing with some chronic pain and stiffness and kind of knee health issues. So this is an area that we really want to focus on and make sure that she's able to pick up some good sensation. So different things that we've worked on in the past, and I've got a couple of tools here that you can work on. And one of which could just be taking like something as simple as a brush. And all you're doing with this brush is you're just kind of going around the scar or the area where you're having knee pain. And you're just trying to pay attention to, can I feel that sensation? It looks funny. How's it feel?
Feels good.
It feels good. Feels good, so that's great. So you're just going around and paying attention to, is there an area where it feels a little numb? Can I not feel the sensation? Right? And then all you're doing, you could go and you could compare on the other knee where you may not have had a surgery, right? To see how does that feel. So oftentimes when someone has a surgery, right, or chronic knee pain, it will feel different on the good knee or the knee that they didn't have the surgery compared to where they did have the surgery. Like Maria and I have done a lot of work, so it's not like we're starting fresh, but do you feel anything just from that?
Yeah, I do feel a difference, but
Yeah.
I do, in comparison to when we first started our work, I do feel a lot more. I have more sensation.
More sensation,
now.
yep. Okay, so a brush, something simple, right? That's one way of doing some testing around where you have your scar. Another thing you could do is provide something that's just a little bit more sharp. So this is one of the things that actually helps people the best, or most often when I work with people. Something sharp. So this is kind of like a metal toothpick, essentially, right? So if you actually had a toothpick or a fork or even a brush, it kind of provides the same kind of sensation. And all you're going to do is just poke around this area. And again, what you're looking for is, are there areas or zones where you do not feel the sensation? Especially because logically you know, okay, that looks sharp. I know that should feel a certain way. But if it doesn't, you know, okay, that's a problem, right? I need to rehab that area so that my brain is able to feel that sensation around the knee, around my surgery, or where I'm having pain. Okay, and then you could just go around and compare. So what do you notice any difference from this?
On this, I notice that I feel the pain more intensely on my good knee, and there are areas on my surgery knee where I feel less sensitive.
Yeah.
And that's particularly around here.
The lower area.
Yes.
Okay. All right. So Maria clearly needs to do a lot more homework.
Yes.
Okay. All right. So Maria has some experience doing this, but just doing this on your own at home, just the first time you should be able to notice some change as well.
Because I think when we first did this work, I was pretty much very low sensitivity almost throughout the whole scar area. And now it's pretty localized.
Localized. So it's better than it was, right?
It's way better than it was.
Yeah. So a lot of times people think, oh no, it's permanent, it's damaged, but no, it's not. It's not permanent. These things can get repaired and rehabbed, and your ability to pick up vital sensation information, right, can change and can improve. Another thing you could do, take a tissue, or this is a paper towel, and it provides a little bit of a different sensation, and all you're doing is just kind of like brushing, right? Not a hard brush, but just kind of like a soft stroke. Just going around the area of the pain, going around the area of the scar, and then doing a comparison on the other side. You do inside, outside, right? You could take your time and kind of investigate and explore at home. And how does that feel?
Yeah, I feel that.
You feel that?
Pretty much all over.
Equally on both sides?
Yes.
Yep. All right, so the whole point of this sensory testing and doing some scar rehab or surgery rehab is to feel and move better. So how do you know you're feeling and moving better, right? You actually have to move around and kind of test things out to see if something helps you, maybe doesn't have much of an impact, or potentially even makes you worse, right? Everyone's nervous system is designed the same essentially, but because we all have different history, what works for Maria may not work for you. So that's why we always have to test it out just to figure out what's the best approach for you. So one way to test it out is stand up and then just take a couple laps, walk around, and then why don't you do a few squats. All right, so what you're looking for is going for a walk, doing some squats, kind of moving around. Maybe you're walking up and down a few stairs, seeing how the knee feels, right? On a scale of 1 to 10, 10 feels terrible, 1 it feels amazing. Like, where are you on that scale? Maybe you're about a 5 or 6, not horrible, but, a fair amount of pain or tightness, discomfort. Then you do some of these sensory tests. You test sharp, test dull, test soft. You can even test temperature, right? You could take a warm washcloth, put that on your knee, move around. You could take an ice pack, put that on your knee. Are you able to pick up all of these different sensations? If you want to be really scientific, after each one, you'd stand up, go for a walk, do a few squats, and try to notice which form of sensation gives you the best results. But overall, big picture here is that you want to make sure that the scar and the surgery that you had previously is rehabbed and that the brain is now able to reconnect to that area of your body. So if you have incision and a scar, that's probably an area that's contributing to your pain and stiffness. So you want to make sure you're massaging that area, you're providing the right stimulus and rehabbing that on a regular basis. And another thing that you could do is provide some KT tape. So this is really simple and easy, but after you do some of this basic work, you can just kind of go manually and pay attention to, okay, when you pull the skin up or down or in any other position, right, and kind of provide that additional stretch to the skin and to the tissue around that area, and then you're moving, does one area feel better than another? And one thing you could do with KT tape, super inexpensive. It's a really great tool when you're having a pain and a problem. But basically, it's like athletic tape. And what we know with Maria is that her brain likes to have that awareness of that area of her body. So if I could ever get this separated, we could do our magic here. So this tape is kind of pliable. And what we know is that if we pull down and then kind of pull the tape up as such, you can leave that on. Stays on there, and it's basically kind of like applying pressure on a 24-hour basis. So you can leave it on in the shower when you're taking a bath. After a couple of days, it'll come off. But basically, all of that good work that you were doing earlier, it could stick, literally. And you can have that on a regular basis. So, okay, so just so you can see the different forms of or the different instruments we're using, this is like a metal toothpick, right? So this is sharp. We've got a couple soft instruments, right? A nice hairbrush, or that's kind of like a painting brush actually. Bit of a tissue paper. Then you can also take something that's dull as well. So this is a reflex tool, but you could just take the backside. You just compare, right? So the opposite of sharp would be dull, right? And your tissue, your skin has a lot of different receptors that are able to pull in different forms of stimulus. And you need to be able to feel everything, right? Dull, and then contrast it to sharp, etc. Take that soft paper. Okay, so hopefully that's some helpful information that you have not thought of. I know most knee specialists and doctors, they won't talk about this with you, but it can have a big impact. It can be a big contributor to some underlying chronic knee pain and stiffness. So give this a shot. Let me know what you think in the comment section if you have a question, and look forward to talking to you next time. See you later.